Dr. Tate Shanafelt, a hematologist-oncologist at Mayo Clinic in Rochester, Minnesota, discusses his article appearing in the March 2013 issue of Mayo Clinic Proceedings entitled "The Medical Marriage, a National Survey of the Spouses, Partners of U.S. Physicians."
So we conducted a study looking at the satisfaction of the spouses and partners of physicians with their relationship. It's long been speculated that physician relationships suffer because of the demanding and consuming nature of physicians' work, and that they may be less satisfying relationships. Despite that, there had been very little data over the years looking at this problem, and almost all of the information came from the perspective of the physicians rather than their spouse or partner. So we had about 900 spouses and partners of physicians from across the United States participate out of 1,600 surveyed. So the study did include both those who were married or just in a relationship with a partner. Most of the relationships were reasonably mature relationships, regardless of whether the partners were married or had been together. The average length of time had been 10 years. And so I think on that front, these are individuals who have deep insights into a relationship with a physician, having lived in such a relationship for a long time on average. But again, there was a spectrum of some who had been in very long relationships and others shorter lengths of time. And what we found was actually a very high degree of relationship satisfaction in the spouses and partners. About over 85% were satisfied or extremely satisfied with their relationships, which is actually in keeping with studies of the general U.S. population. We also found that a majority of spouses and partners of physicians were employed independent of age or gender, contrary to some stereotypes about physician relationships. We found that the dominant characteristic that predicted satisfaction was actually the amount of time the spouse or partner spent with their physician partner each day. And there was actually a very strong dose effect. So relative to those who were spending less than 20 minutes together each day, those spending more than 120 minutes each day were about 8 times more likely to be satisfied and about 90% less likely to have seriously considered a divorce in the last 12 months. That effect of time spent together was the strongest predictor of relationship satisfaction on a multivariate analysis, adjusting for a whole range of other characteristics of both the spouses and their physician partners. Yeah, so there was a lot of characteristics that we looked at in the multivariate modeling, including the sex, the age, the specialty choice, hours worked, whether the spouse and partner was also employed outside the home, a number of these features, the call schedule and so forth. And the amount of time spent awake together each day was really the dominant characteristic. The only other characteristic that really persisted on the multivariate model to a much lesser effect was how frequently physicians were on overnight call. Notably, there were almost no characteristics of the physician's practice that predicted relationship satisfaction, including hours worked per week by the physician and specialty. So it seems that despite the demanding nature of the work, as long as physician relationships of both partners are prioritizing time spent together, that can immunize against a great deal of the challenges the relationships face. Different types of practices, I think, have different challenges. Physicians in private practice often are thought to work longer hours on the days that they do work, but they sometimes work fewer days per month than academic physicians. And academic physicians do often spend a lot of time away from home to present at meetings or review grants and on study sections and so forth. And so they are challenging for both types of physicians, but perhaps in different ways. And it seemed that more so than where physicians practice and the type of practice they were in, it was as long as they were preserving that time with their partner that the relationship would thrive. One of the interesting areas that this sheds light on is the specialty choice of medical students and residents in their training. We've seen a trend over the last decade for physicians in training to choose what are called lifestyle specialties that allow greater control over work hours, call schedules, and work-life balance. And what we see, at least as it pertains to relationship satisfaction, is that really physicians in any specialty can have a good relationship on the home front, and that specialty and hours worked, again, were not predictors of relationship satisfaction in this large study, but more the prioritization that physicians placed on nurturing their relationships and making sure they had adequate time at home despite busy work schedules, regardless of the specialty or practice type they were in, seemed to be the bigger driver. Despite the high relationship satisfaction, we certainly did see that these relationships did face some unique challenges. It was quite common for spouses and partners of physicians to report that their physician partner came home too fatigued to engage in family activities, came home very irritable a number of nights a week, or often had difficulty focusing on life at home because they were preoccupied by things going on at the hospital, and so had difficult time engaging in some family activities. And those were commonly described by spouses. So I think, again, these are somewhat unique challenges to physician relationships, and physicians and their partners do have to find ways to navigate those challenges so that they can thrive on the home front. So I think in the conclusions would be that there's not good evidence that physicians' relationships are of any worse quality than other relationships in areas outside of medicine. We see that despite the high number of hours physicians worked and the demanding nature of their job, if they're spending the right amount of time with their spouse and partner each day, that seems to really protect and nurture the relationship and to sustain it over time.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.